Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Cancer Buzz is in D.C. this week, reporting from ACCC's 51st Annual Meeting and Cancer Center Business Summit. If you're following along, we're bringing listeners in to hear from the speakers and some of the highlights from the week. There were several popular deep dives on AI this week. We heard feedback from a lot of attendees who thought the information that was presented was new and very valuable to their everyday jobs. One of those subject matter experts who led the sessions is who we are with now. Dr. Douglas Flora is the president-elect of ACCC, newly president-elect as of today, and the executive medical director for oncology services at St. Elizabeth Healthcare. And he's also the editor-in-chief of a popular publication called AI in Precision Oncology. Dr. Flora, it's always great to see you.
That's all the time we have?
There's probably 4 more titles that you have, but I cut it short.
Thanks for having me.
Let's talk about the session yesterday. AI is one of the hottest, words in healthcare, and also we can't get away from the headlines and the podcast about AI. You really broke it down for attendees yesterday. How can busy oncology providers cut through all of that noise and find the AI solutions that will really help improve quality of care for their patients?
That's a great question. What we really tried to focus on here at ACCC is the nuts and bolts, how do I do the thing that I know I need to do? And so this session was really not about theory, it was about practice. And we had 3 of our member institutions demonstrating successful programs, the financial ROI, the human ROI, the things that they've done that have eased their burdens as cancer fighters. And it was really, I think, enabling for the other organizational people in the room to see other people who've gotten in maybe 6 months or a year before them, and it can be done seamlessly.
You talked a little bit about financial ROI. I know folks are really interested in that. Tell us about that, what the highlights were.
Yeah, I'm a white coat doctor. I care about the outcomes that, matter for human suffering and survival. But to do that, we have to keep the lights on. And there's a real world out there. And obviously, the hospital company business and the private practice business is tough right now. So we wanted our members to have an opportunity to see that these things can not only save lives and enhance early detection per se, or, clinical trial enrollment, but it can have a financial downstream effect that keeps your cancer center healthy, keeps your hospital system healthy, driving maybe some margin positive things like surgeries because you've identified diseases in their faintest footsteps, or enrolling patients on more clinical trials, which helps keep your clinical research division afloat. And so the demonstrators, the people presented, have well-formed, well-thought-out programs that have shown those successes in real numbers.
So you had case studies. Can you tell us about those?
We did. We had several of our members. One showed how powerfully they've been able to introduce incidental pulmonary nodule detection using software that overreads the radiologist and identifies, of 150,000 CT scans that are done in their system, the number of patients who had incidental nodules that merited follow-up but never got it. I thought that was very powerful. And then they could show the downstream effect for the healthcare system, all the procedures that were done, the PET scans, the surgeries, the ports, the chemo, the radiation. And 70% of those patients who were detected in that case study had early stage disease and were probably saved from lung cancer.
Wow.
Another presenter was talking about how they've been able to expand their community clinical trial program using things that would screen and save the CRCs and save the CRNs all the time that they're spending on screening for clinical trial patients.
You talked about human ROI. I haven't heard that, so tell me about that.
Yeah, to me that's the important one. So my goal in this is we're trying to drive smarter cancer care. We're trying at ACCC to be the GPS device that helps lead our member institutions to maybe an easier journey into AI. And for me, the end goal is that we provide better care, we reduce suffering at scale, we help the people who are suffering burnout or having staffing difficulties. And it's not a panacea. It's not going to fix everything, but it should be a tool that we evaluate carefully to institute responsibly in those areas that we know there are gaps. And by driving that, ACCC hopefully is going to help educate our members and make sure that they're the early adopters who take the greatest advantage of these things.
It sounds like it's been a productive yet busy week.
Yeah, it's always hectic but fun. I get to connect with old friends like you. We're heading into board meetings the rest of the day, and then I'm going to go see Georgetown tonight. So I'm always glad to be in D.C.
Fantastic. Thank you, Dr. Flora. That'll do it for our coverage here at the ACCC 51st AMCCBS. If you haven't heard all the shows from the week, go back into the feed and to see what you've missed. Until next time, for the Cancer Buzz team, I'm Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.